action, we have a new contract for the demolition and abatement of the old jail facilities.
So the contract is currently out to bid. The bid results will come in on September 7th or 8th. I apologize. I think if it's, I believe it's the 8th. So I will have the numbers and who we would award to by the board meeting.
That's good. So do we need a motion for this?
You do.
All right, can I have a motion to Supervisor Conover and Supervisor Strong the second? All in favor?
Aye.
Opposed? So moved. All right, let's jump on to discussion items.
And I will turn that over to Scott for the first couple.
The work order request form, or program, I should say, is it currently running again smoothly. 2,418 requests have been done and completed since the inception of this, almost at our 2-year anniversary. Will be in November. So that's very well received. The fleet car program currently is running very, very smoothly. We actually have every car signed out for every day this week. There are no cars available right this moment. So we're going to have to find something if somebody else needs some. So it's just an opportunity for everybody's getting very well acclimated to it and requesting them on every day. So they're out of here. That's it for those two.
Oh, those two. You want to do the Countryside Dell Home?
Yeah, I'll just give a real quick update. Countryside Adult Home is out to bid as well, and I believe the bids on that will be coming in on the 13th or 14th. And today is the pre-bid meeting walkthrough with the contractors.
Correct.
Yeah, we had a meeting yesterday about some of the private residents being able to do this so we can have more room and hopefully get the project moving quickly. And so it's happy to, I'm happy to see this moving forward and finally coming together. So the regional morgue discussion, we do have Dr. Sikorica with us today, and you're more than welcome to please come up to the table and join us for any questions
That's
Okay.
the photo right there.
for
Okay.
the podium.
Do we have that PowerPoint up?
I don't have one in the meeting yet, and I can put it in the cabinet. Yeah.
We can do that.
Can we set a hole in the screen?
I didn't get it.
So we've had a discussion going on about the old jail and the use of that facility. And I know there's been a lot of discussion around a regional morgue. So last month, my senior civil engineer, myself, Tim Murphy, and Dr. Sikorica met to kind of go through kind of the parameters of what you need for a regional morgue. We don't want to jump the gun. We want to make sure that we're going through the process correctly. We want to make sure that facility would even work for a regional morgue. So Dr. Sikorica enlightened me a lot about what they require. And I asked him if he could come here today and maybe put a presentation together, just basically say, you know, this is some of the things that you should be looking for. So, and she's pulling it up right now.
Okay.
So,
Well, we're pulling that up. I do. I really want to thank you for your time and coming in. Your reputation precedes you. I've heard the name for so many years as the doctor that everybody requests. So thank you again for your time and joining us.
My patients don't really request me. Hopefully that will work. If not, I can present what I have.
That's the question while we're waiting.
Sure.
Oh, yes, go ahead, Mr. Strzok.
Regional morgue. Well, we're going to do medical examinations there too, right?
Only on the deceased.
Yeah, yeah, well, of course. So, well, I'm just thinking would be
What's he saying?
Connie Gaddard favors this idea too.
Those
In
mics.
fact, she put it forward to me. And she was calling it a coroner's and medical examiner's facility.
Yes.
Okay.
Well, the whole state is in a little bit of a discombobulation about coroners and medical examiners. We have a medical examiner system in some counties. Rensselaer has one, Schenectady. Albany has coroner system. Everything up north is a coroner system. So there may be the possibility that some work for medical examiners could be done here. But it would be pretty much a regional morgue facility and not really a medical examiner's office.
Well, I think Connie was saying there was a need for such a regional medical examiner's
Well,
place where actually we could bring in revenue, if I understood her.
oh, yes, that's the whole idea. But a medical examiner's office typically involves a lot more than what we're looking at. Medical examiner's office would be hiring medical investigators instead of coroners. It would be working on a much larger scale. It would probably involve a lot more cooperation between counties, and it's a different animal. So
Okay.
I would just kind of explain what we're looking for here, and we can talk about the differences.
Okay, thank you.
Sure. So it's possible evaluation and planning for a regional autopsy facility, a regional morgue, in other words, to address the future requirements of the public and the regional coroners. Next, so what are the problems? We have, right now, we're doing autopsies in hospitals. Glens Falls primarily, also Saratoga. Occasionally, I do autopsies in Nathan Latour Hospital. But the hospitals don't really want us in their facilities, to be frank. Albany Med several years ago actually shut off our access as forensic pathologists and medical examiners. They didn't want anything to do with us, and they gave us a month to find a new place to go. Albany Med at that time was the whole focus of everything done in the upstate area. This happened about 3 days after I just finished the limousine crash. They decided they no longer wanted to do any forensic work. So we had a large meeting with different county people, sheriff's department, state police, and we were able to convince them to let us keep doing cases there. But of course, they raised the price and more than doubled the price to do that. So there's always the risk that a hospital can kick us out for whatever reason. And it's really not a great place to do this kind of project in a hospital, because we're bringing possibly contaminated or infected bodies into the hospital. It's better to have your own facility for independence. And what happens if we have a death in a hospital and we do it in the hospital, where we're always accused of compliance with the hospital, some conspiracy that we're protecting the hospital. So they don't want us there. Some pathologists in the area will do autopsies, even though they're not forensically boarded. They will do autopsies in Amsterdam Memorial or Amsterdam St. Mary's Hospital. They're doing autopsies, but they only handle the simple cases. They don't want anything that has any hair on it to speak. They don't want to have homicides. They don't want to do infants. They don't want to do decomposed bodies. So they pretty much shuttle everything that has a problem to other places, like here in Glens Falls or Albany Med, where we still do some cases. Most residency programs barely train the residents in autopsies any longer. So there's not a large pool out there of doctors who are going to go into the community and want to do autopsies. Majority of the new pathologists have no desire to do autopsies, even if they're reimbursed. So many will simply refuse. We've had cases in Glens Falls Hospital where they've hired a pathologist, and within a few months, that pathologist has left because they were burdened with the autopsy service. They didn't feel comfortable. Even hospital autopsies have fallen to near zero in many places. It's very, like if you were to die in Glens Falls or Saratoga and you would request an autopsy, you would probably not get it. Only in very selected cases would you have a hospital autopsy, because they're expensive. The hospital has no reason to do that. So if the attendings feel comfortable with what your cause of death is, they will sign it out and say, okay, if you want an autopsy, you can hire your own autopsy. And that typically ranges anywhere between $3,000 and $5,000. So Many morgues are now just storage filled with junk. That's down in the Capital District. St. Peter's had a morgue that was active for a long time. That's inactive now. Samaritan Hospital, I've been in their facility. It's just full of junk. They don't use it. So there's a big issue with the hospitals. And using the hospital pathologists, of course, is the problem. Very few of them are certified in forensic pathology. They like a very set schedule. And none of the major organizations in forensic pathology recommend using them at all for out-of-hospital deaths. So nevertheless, there have been scandals in the ME community as well. I'm not going to paint a picture that medical examiners' offices are perfect at all. Do we get the next one? So why a regional autopsy facility? Well, one county by itself doesn't really have enough in this area to support a full-time forensic pathologist, okay? A full-time forensic pathologist is probably going to have a salary of somewhere between $180,000 and $240,000 a year. Okay? That would be very hard to keep going, plus paying for his staff and everything else, with 100 to 200 autopsies a year. You just couldn't do that. But if you cooperated between counties, a facility could probably sustain itself between 400 and 600 cases. And that could utilize 2 forensic pathologists and their support staff. And we can talk about the support staff. We would need a transcriptionist, you would need an administrator for the facility, and the autopsy techs or the assistants themselves. And if a central facility had been constructed, the cost for out-of-county cases that are done could be passed back to the counties that sent you the bodies, the decedents. So if we were to do it here or wherever it was decided to, if a body was to come down from, say, St. Lawrence County, they would simply pay a set fee for that. That could be anywhere between $3,000 and $5,000 for the use of the morgue and the pathologist. So it would be billed as an individual basis. So each county that would probably have a contract with the central facility to do the cases. That's how it's done in other counties in the state. It's hard to find forensic pathologists. So we'd have to find somebody, or 2 people actually, that would be willing to come here and work in this facility. So we would have to have a facility that would be decent. And if you look at the statistics, only about 50 ever qualify to take the board exam every year. So there's not a great wealth of forensic pathologists out there. There's only about 400 or 500 in the whole country. And the idea is a lot of pathologists, they don't want to deal with the smells, the trauma, going to court, the lawyers, the police. They don't want to deal with that. They can sit at a microscope and make more money. And that's why many residents don't even want to do autopsies. We have a good advantage here if this was to be done with a decent salary and a benefit package. The attraction in this area is the lifestyle, I think. You could pull people from the city, you could people that are well-trained, that want to get away from that kind of lifestyle, that want to get away from the overloaded work, that want to get away from the crime and the high price of living, to come up here. And this would be a good thing to draw them in with a family, outdoor experience, if they wanted to ski, boat, fish, whatever, and a quieter pace of life. So I think if the facility was built, it would have a very good chance of drawing people to it, drawing forensic pathologists to it. Now, I'm close to retirement age. I'm going to stay as long as I can, but there has to be some replacement in the works. And it's going to be very hard to find somebody right now who would freelance it as opposed to coming and actually being in a facility. They need support from the counties, the police, and the community. They need a good place to work. They need a good wage, and they need time for family and continuing education. I haven't had a vacation in 21 years, so I've been stuck doing this for 21 years now, continuously. So there's not a lot of people that are gonna want my job. All right, so it's a problem that's occurring all over the state. The issues are massive. I know I've spoken to the coroner in Lewis County, and she has one doctor who is doing their cases, Dr. Livingstone, and his health is failing rapidly. She doesn't know what Lewis County, Jefferson, or St. Lawrence are going to do when Dr. Livingston leaves. This has been an issue that's been kicked down the road for a long time. There's not a lot of forensic pathologists out there, so it's going to take cooperation between the counties to set up something where a centralized morgue facility could be used to draw a good pathologist and make things a lot easier for the families to avoid the transport of bodies for long distances. Right now, Lewis County is sending bodies to Binghamton because there's no one else to do them. Syracuse used to do them. They refused. They're overworked. So if something were to happen to me today, the closest forensic pathologist you have that would be able to do autopsies is in Binghamton. And that is possible. I mean, you could do that, but we have to think about the future. You know, we realize that the finances are limited in each county, but how do we handle disaster if it happens? There's no mechanism for that. There's no place to store a large number of bodies. Okay, what happens if we have another Ethan Allen disaster or mini disaster? Where do we put 20 decedents? That's an issue that's got to be really looked at. The corners, some of the corners are very sharp and some of the corners are not very sharp. So you really need some forensic pathologist to give them some guidance. Where do we store the records? A lot of records are being stored in the coroner's homes. You have autopsy reports in coroner's homes. That shouldn't be there. They should be all centralized and put in a safe location. Who's keeping any statistics on the drug deaths that come from the ME office? Really nobody. That could be done as a central office. And how can we share information across the counties? Because Washington has a lot of bodies that come here, they die at the hospital. You know, that is actually a Warren County case if they die in Glens Falls Hospital. But we have to have cooperation so we can get the information from Washington County and use that to determine the cause of death. So it's a very complicated process here. It's not simply building a place. It's also establishing sort of I don't really know how to put it, a job site or a work environment where the cases can be done and to find the right pathologist to come and do these cases. Otherwise, it's going to be a big problem in the future. We're just going to kick this can down the road. And, you know, if I can help in any way, I'd be happy to talk to anyone. There's my phone number and how to get me through my administrator. I'm really busy. I'm doing I think I'm going to do 289 cases so far as of today. That'll be 290 autopsies, which is a lot of autopsies to do. 1 year I did over 800, so it's just insane. Does anyone have any questions? I'd be happy to answer them now. I got a few minutes. Yes.
Thank you, Dr. Sigurd. That very informative, and I'm very pleased to hear this. We had a little chat at the beginning. And like I said, I did talk to, Dr. Duffy at the Adirondack SUNY College there to, maybe bringing up some forensic classes as another option of having a classroom here to help entice more people to come into the field. You watch any of the TV programs, and there's so many out there on the in the medical, especially in forensic, and what you do is a specialized. So is that something that is a possibility in being in your field that could help?
If there was definitely adequate time and staffing, that would definitely be an option. And also a place to perhaps have small mini conferences for police. I know there's speakers out there that will come and discuss certain aspects of forensics like drowning, electrocution, things like that. And the possibility is there, absolutely.
And along with, along with the forensic pathology is, just really doing basic autopsies for the families that might want to know why a member passed away so quickly or at a young age, or if they had some form, genetics that they'd like to know about further, which would possibly drive down the cost of having a different doctor, come in or availability for that doctor to do a report, because I know yours is more of a specialist and very busy. Those were my ideas of when I thought about this whole process of making a regional morgue. Supervisor Garrity?
Yeah, this facility be BOH regulated, Department of Health, or?
Yes, yes,
So there's certain criteria.
yes. You would have to make the criteria, ventilation, sanitation, things like that. I mean, it's a decent sized project. Yes, it is.
Supervisor Conover?
Has the Department of Health engaged this problem, this issue on a statewide basis with any type of initiative?
No. I've been struggling in the Albany Capital District region for 10 years, trying to get Albany, Schenectady, and Rensselaer County to cooperate on a regional morgue. I went so far as to go to the state police. There was room to do this at the Troop G facility, the Troop G barracks in Latham. I met with the major there, and met with some architects to discuss what we needed. And the consensus was that the coroners were happy and they simply ship all their bodies to Ellis Hospital, where they're done by somebody that is not board certified to do these cases.
I might follow on. I mean, it sounds to me like that it's a problem that's looking for some leadership.
Yes, it is. It is.
I mean, up and down the ladder. It would be nice to know where the exact plug-in is at the state level. Would it be the commissioner, Department of Health, one of his deputies? It would be nice to know who that is, and then to have some type of a sit down to talk about strategically what the issue is across the state. And because it seems what you're saying is that even the more populated areas is an issue for them as well. Perhaps not as significant, but it's.
Yes, it is. Yeah, I don't know of any plug-in, any person that's really expressed any interest in grabbing this problem in the state level. And it's been presented to them.
Maybe that would be an excellent, among other steps, that would be an excellent first step to have some recognition of this, and then have some energy put into this at the state level. I mean, we can certainly, do it ourselves in an isolated way, but it seemed to me that there are bigger issues here, bigger questions that really need to be engaged.
It's definitely a statewide problem. There's coroners all over finding this problematic.
All right, Supervisor Stroud.
Yeah, let me piggyback off Supervisors McGowan and Conover. I think this is an excellent opportunity for Warren County to show the leadership that it has been known for in the past. I know we've been mired in this and that and the other thing. This is an opportunity for us to get on the right track again. And it also, speaking to County Gutter, now listening to the doctor, this is a need for this. And I would think, although I don't really know, But I would think there'd be grant money to help create this facility. So,
The American Recovery Act that came out after the COVID addressed this all, and we were listed as one of the beneficiaries if that money could be used.
well, we're gonna
Definitely.
use some of that money to do the asbestos removal and clean the building up.
Be, that money was actually allocated, part of it for the use of the medical examiners and coroners to restore facilities, to build new facilities, to build storage for decedents. So if that money is out there, left, I don't know what's left. Many places I understand have already used their money up. And, but it was really allocated, part of it was allocated specifically for medical examiners. If you look at the grant request.
Supervisor Garrity?
Yeah, I think we should pursue this. I think we should also pursue it with our federal officials to let them know that this is something over and above that we've been awarded, and try to get them interested in doing this on a regional basis. And I agree with John, the leader, and Ron. I think this is a good idea for a facility that's sat vacant since 2004. And, you know, it's creative thinking. Thank you for the creative thinking to try to repurpose that building to do something that's very needed in our community and the surrounding community. So I would think that we could, as John said, be a model, seek out federal dollars. I mean, if you listen to the news every day, they've misspent a lot, but this wouldn't be misspending a lot to do autopsies. You certainly could, the proof is in the pudding. So I'd like to see us pursue it, even though I'm not on, you know, I would like to go the next step, if that's okay.
Well, we have the federal level. We also have the state level. I mean, Supervisor Connor brought up a good point. And Doctor, how many, hypothetically thinking off the top of your head, you know, not really to hold down a number, but how many counties do you think we could join in?
Well, I know we have a lot of interest from Clinton County, Franklin County, Essex County, even St. Lawrence County would be probably wanting to join in to some degree. I do all the cases for Saratoga County. I think there would be a good opportunity to bring those up here. That would be, you know, you're looking at just those, you're looking at probably 300 right there, just Saratoga and Washington, Warren, plus all the other counties that would be shipping bodies here. Hamilton is interested. I've spoken to the coroner in Fulton County. She would be interested. They don't produce a lot of decedents, which is a good thing. They don't have a lot of decedents, but they have need for services when they do have those bodies. And they would prefer to send them to someone that is board certified and is willing to go to court and can stand up for the cases.
Now, you also mentioned Lewis County, he might be retiring, but do they have a facility up there or?
They're in the same quandary we are. They have used the hospital in Lewis County in Watertown. So they're looking now, from what I understand, at trying to build something or get a regional system of their own.
See, that my whole idea is, you know, we're kind of a hub right here off of the Northway and all the other pieces coming into the north. So this is great. Superintendent Adros.
I just wanted to add, I mean, I think this is a great idea too, but I think that kind of the next step is, as Chairman Garrity just said, is probably, I mean, I think the first step would be to facilitate a meeting with other counties to get their buy-in. I don't think it's build it, they will come. I think we got to get their buy-in and then we'll build it. I think that's what we need. So I'm not sure, you know more of the chairmans in those other counties than I do. I'm not sure if
We could certainly reach out to them, send them a notice of intent, you know, or something like that.
So that's the next step. Do we need a motion for that or? No? Yes, Supervisor Connor.
I think the thing that strikes me on the presentation is building a facility, we can always build a facility with whatever buy-in we got, but how do we properly staff that facility?
Yes.
That challenge, it seems to me, is as important
Yes, it is.
as building the facility.
Yes, excuse me, you not only need the 2 pathologists, you'll need some support staff. You will need an administrator probably for the building. You need autopsy assistants, at least 1 full-timer, probably 2 part-timers. You'll need a transcriptionist, a case manager. So there's a support staff behind that whole facility. I worked as the deputy chief in Rhode Island for about 7 years. We did a major airline crash back in 1999. It was 217 bodies. So we had a very good facility. We had the support staff behind us to do all the report material. We also called in the feds. The DMORT team came in. So it's not simply just driving 2 doctors. It's building a staff to support them. The autopsy techs, I know techs right now that would come to work to do the work. I know an administrator that might be interested in coming, has experience in this kind of thing. So there are people out there, definitely.
I would, I'd recommend, Mr. Chairman, that if you could reach out to our state representatives and have them arrange a meeting at the New York State Department of Health where they need to see this presentation. And they need to, if it concurrently, we can get some level of interest from the other counties, that can be represented at the meeting also, so that if and when we step out, you know, all together on this. And not doing a lot of wheel spinning. So I mean, I think that this presentation, this message, and especially you, sir, need certain venue, certain start off point. That would be could be a very instrumental, very constructive meeting.
Yes, I did work with, actually, I worked with the New York State Association of Counties. And I worked with them, and they actually put a nice paper together on the needs for funding these regional facilities. And they were very supportive. They approached Albany just as I did. I had their backing, and it just puttered to nothing.
We could secure that paper.
Yes, it's,
Be
yes.
interested in.
Supervisor Stroud.
Well, let me piggyback off of multiple things that are going on here, which I think are great ideas. We got that paper that shows the need. It'd be nice too, before we call the county together, if we could just do a quick conceptual. Doesn't have to be anything that we have to live by, but something that when we invite the other counties to join us, we got a potential title and we have a potential layout. We have the facility available. I just think it would help invigorate the discussion if we had something tangible they can look at, aside, along with that paper.
Yes.
Well, I believe that was one of the reasons that having the doctor come in today to help move us in that direction with talking to Mr. Hajos and trying to come up with a conceptual layout of, you know, what we can do in that building. So, and you've been working on that, or well, we would be working on that.
We will be working on it. And I don't have the staff that can do that conceptual plan. I would have to put that out to one of our consultants to do, simply because I'm short on staff. But we're gonna have a blank canvas. I mean, once we get these bids in, and if we award, hopefully bids come in reasonable, because they haven't lately, we would award and have that demo. So it'd be a clean building to be used for whatever. And I could have our consultant who did the demolition design and abatement work to kind of give us a real quick conceptual. But I'm going to say it's not going to be a week. It'll be a minimum of a month to 2 months. But I don't think, based on what Dr. Stickerick said, is this problem going away. So it's not like we're going to lose this regional morgue to somebody else.
Well, no, but I mean, with the input of the doctor, maybe giving us some quick little notes of what he would like. I mean, I don't know, anything we could do to keep this process. We've been working on it for a while. I'm so happy that we're here to this point. I'm kind of excited. Maybe that's why I'm so wound up today. You know, I didn't know why, but It's been a long time getting to this point, and I'm glad I was able to chair today to talk to the good doctor and have it here and how far we've come. So we all have a plan. Yes.
Just a question for the superintendent. On a conceptual plan like what Supervisor Strau had just mentioned, what would the cost through a consultant be perhaps?
I'm not sure I can give you the answer. I mean, if I do a conceptual and I give them the scope of work for that conceptual, just kind of do a quick layout, I'm guessing anywhere from the $2,000 to $5,000 range.
I have, just to address that, I put some sketching together myself years ago. I meant to get that to your chief engineer. But if I had the dimensions and everything, there is actually a state police investigator who had been an architect who volunteered at no charge to work up some very preliminary designs if we knew the size of it.
Do that.
If we could take advantage of that, I would be more than happy. We can, do we have a sketch of the, I almost brought my paperwork in today and I could have handed you over my prints, but we able to get a set of prints over. Basically just the measurements is all we need. Just take the.
Yes, he's very helpful. He was a licensed architect. And we talked about it. And he was going to do some initial drawings for the facility down there in Albany, but politics got in the way.
I'll provide those to you, Dr. Seuss.
Wonderful.
Thank you. So this is great. Is there any more questions or discussions on this? Do we have a good game plan of moving forward? I'm excited. So, all right. Doctor, I want to thank you for your time and really your insight. It was quite a pleasure to meet you and have you here today.
Thank you very much.
I look forward to working with you in the future.
It's an honor. Thank you. Have a good day, everyone.
Yes, we're up. Do you want to run the meeting? No. All right, next up, we have the Needham risk discussion of the workplace violence assessment. I see they're back there patiently waiting. Thank you. Oh, yes, Mr. Hadris.
I just wanted to add, I updated the agendas this morning and the assessment that's in your package is not public knowledge. It talks about safety measures in the county center. So please do not share that. Or you can turn them into me and I will take them all back. But I wanted you to be able to have what was stated in that assessment. And Mike Needham is here to kind of discuss it and then we can ask him some questions.
I was going to ask that. Thank you.
If you wanted to do executive session, we could justify it under public officers law 105A, discussing matters for public safety if they're disclosed, about security. The public comes into the building quite frequently in large numbers. It's up to the committee if they want.
So I will run a poll here of, do we feel we should go into executive? I have a lot of yeses, so I'll need a motion to go into executive session. Supervisor Conover, Supervisor Strauss. All in favor? Opposed? All right, we're going